That's a that's a large percent of the people. But then the red here are those people who were hospitalized, and the black are those that died. And we see that when you get the disease, when you get COVID, this is the roulette wheel you're spinning every time. Now, the roulette wheel looks a little different if you're older. It looks a little different if you have, there are other sort of characteristics in terms of your comorbidity, how many other diseases you have. Even ethnicity seems to affect this. But by and large, this is what is the roulette wheel. And these are actual proportions of what could happen. With of all the cases of COVID in this country, the 6 million hospitalizations and the now over 700,000 deaths are reflected. So this is what happens when you take a chance in getting the disease. This is the wheel that everyone spins, anyone can spin. And this is why. This is the symptoms that we all know when people get COVID. We know about all the symptoms of fever, cough, muscle aches, fatigue, sore throat, headache, loss of some taste or smell. Diarrhea is a symptom that at times came in waves into our hospital, congestion, runny nose, but of course, even more than this was, of course, the symptom of shortness of breath and difficulty breathing. During the COVID, this is what we see in the pictures from emergency rooms and ICUs throughout the country, or people sort of gasping for breath and on respirators or on other kinds of oxygen. And these are the things that we have to keep in mind when we talk to people when they're talking about concerns about the vaccine. But this is about this is about preventing the disease and all the things that the disease can cause. And then, of course, they say, well, what about the long-term effects? Well, there are long-term effects from COVID, okay? We have just begun to see how much when you get the disease, when you get COVID, it doesn't just affect the lungs, it's affecting the heart, it's affecting your kidneys, it's affecting your brain, it's affecting your lungs, and it's affecting even your ability for your blood to clot. All of these happen at an extremely high rate in terms of there's lots of cases of people with very serious long-term effects, including this brain fog here is something we're really beginning to appreciate in patients who've had COVID. They actually have difficulty in concentrating and thinking. And there's even a lot of research now going into, is there an increase in suicidality after people have had their brain affected by COVID? These are long-term consequences getting the disease. This is, again, what you're always going to weigh against what happens when you get the vaccine. So the vaccine, this is what counterpunches the virus. Let's go over the vaccine very quickly. It'll be just a few minutes, and then we'll talk about the other issues. So the vaccine, this is a great slide that was produced by New-York-Presbyterian because it accurately depicted why we went from years of a usual process for vaccine development and we're able to condense it to months. It's not that, and each one of these phases is very important. Phase 1, phase 2, phase 3 are the different phases where you have increasing number of patients that are being tested with the vaccine or drug for that matter. This would be for any drug or vaccine before it gets to an FDA review process. And the thing about the review process is that it takes 1 to 2 months for any vaccine or drug to go through review. The problem why it takes 1 to 2 years is that there's a queue, right? There's a huge list of drugs that have been before it that usually you have to wait your turn in line in order to get, once you've gone through all these phases before you get to the FDA or CDC expert review. They're just reviewing things as they came in, and so it can take time. So what they did with COVID is because of its impact on the economy, because of so much of the economy, remember in that April, May of 2020, how much had to, when we first shut things down and to this day, the impact on the economy, we knew that money had to be spent in order to get the vaccine out as quickly as possible. And so what they did was anyone who had a reasonable expectation of producing a vaccine, they said, we'll give you the money to do your phase 1, not wait for phase 1 to be done to give you the money for phase 2, not wait for phase 2 to be completed to give you the money for phase 3, and not even wait for phase 3, but to give you the money to produce it. But there was a huge caveat. If any of these phases did not pass the usual requirement for successful safety evaluation, if any of them failed, you would not be able to bring your product to people. You may have been given the money to produce it, but they would just say, if you couldn't get all these 3 things done, we're going to throw them out. And we give you the money to make it so you don't lose money on the deal, but you will not be able to give it to anyone unless all these phases were done. And as production mounted, you still waited for this FDA approval, which still took 1 to 2 months with any drug, but you didn't have to wait for any other drug or any other vaccine before it. As soon as they were ready with their results, the FDA dropped everything, CDC dropped everything and said, okay, give us the data and we'll review it first. Now, of all, there were like 6 or 7 companies that had proposals that money was given in order to go through this process. And as we know, in this country, only 3 were approved of all of those. The rest were not able to get through all of these phases and get it approved. So this is why it took months rather than years, not because anything was short-circuited. And of course, the research that went into these vaccines had been going on for years before that. And we had generated on a much smaller scale for other diseases the same type of mRNA vaccines. But this was the first large scale, so they wanted to make sure that all the phases went through appropriately. And then when you look at the vaccine, the side effects for the vaccines, you see here, this list is very similar to the pictures that we showed for the disease. It is giving you a vaccine against the disease. And because in this particular disease, your immune response is very much tied in with your symptoms, right? It's not just the virus that invades your organs, but it's the fact that it affects your immune system in such a way that it actually also causes symptoms because of the type of immune response. We see very similar types of symptoms with the vaccine that we saw with the disease, but to much less degree. This is what we're always weighing. It's a fraction of the intensity and it's a fraction of the number of people who get these symptoms when they get the vaccine. Clearly, most get soreness in the arm, the fatigue, the chills, the headache, the body aches, the nausea. And the main thing would be a swollen lymph nodes. I've seen a few cases of that, but it's very rare still and it resolves, okay? The 2 organs that seem to be affected, remember all the organs that were affected by the disease, by the virus. When you get the vaccine, you're protected so much in every one of these categories. Of 2 of these in particular, there's a little bit of a breakthrough of problems with, even with the vaccine, it can only protect you so much. And so still there's some inflammation of the heart and some increase in blood clots that we've seen with some of the vaccines. But these are 1 in a million reactions. So we see that the actual, even among the types of systems that seem to be affected by the vaccine, it's still a fraction of what happens when you get the disease or the virus. And so this is exactly why we always have to look at the vaccine balanced against the disease. And that's what there's nothing new about what the vaccine does. It's just at every level and at every organ, it's protecting you. It's giving you less chance of having a problem than by getting the disease. And then, as we talked about earlier, the initial image that we have on Colin Powell, I want us to remember that the vaccine is not just there to protect you, okay? It's also about protecting those in your community, okay? For those who can't get the vaccine, if they're too young and they're still not yet able to get the vaccine, but also people whose immune system is such that their immunity, even with the vaccine, starts to wane, starts to decrease after getting the vaccine, perhaps at a faster rate. Mostly, these are patients with weakened immune systems, and the most people with the most weakened immune systems are those that are actually, whether they're an HIV type patient who has an immune system, but other dysfunctions include people who get chemotherapy, for example, for cancers. That's actually trying to reduce the immune system's response to a lot of it ends up reducing the immune response very severely. And patients who have cancer, and especially those getting chemotherapy, even with the vaccine, and this is the case we see, and it may be something that is associated with Colin Powell. He had multiple myeloma, has been reported in the news. And so there are going to be people even who get all the vaccines that we are trying to protect. And that's very much goes because when you get the vaccine, every time people get the vaccine, you're reducing the chance not only of getting the disease, but even if you do get the disease, you're reducing the number of viruses that are produced in your body significantly. And the less viruses that infect people and the less viruses multiply when they do infect someone, the less chance there is for a mutant to come up that will be more deadly for the next wave. We're trying to prevent that next wave. And the more people who get the vaccine, the more you're protecting those that are most vulnerable, as well as the community at large. So the benefits of the vaccine, everyone's heard this in the news. You got to just make sure you have that at your fingertips, that over 99% of the hospitalized patients in this last wave were unvaccinated. Okay. Now, in the rate of deaths, we said that there were about 5,000 deaths among all the people who got the vaccine and still ended up dying during this period. But that is because we're talking about 300 million people, 200 million plus people getting the vaccine over almost a year period. Well, since January of this year. And if you look at the number of deaths at 5,000, that's very comparable to the amount for that number of people, of the people who died from choking on food during that same period of time. This is something that, we have reduced it to the bare minimum of deaths, that you don't want to increase your chance of death. You want it to be, the life is dangerous. Just walking out, everything is dangerous, but we've minimized it. We try to make things as safe as possible, try to do everything that we can, and getting it to this level is what the vaccine allows us to do. Now, enough vaccinated people, I don't reemphasize this, not only provide a buffer around the COVID infected patients, reducing the number of people who could get infected, but also when they do become infected, there's less of a virus burden. Less copies are made, and when less copies are made, there's less chance that variants that are more deadly will be created. So the real question is, how many people have to be vaccinated to see these results of really reducing pushing COVID out of our country, out of our community? Okay, we were hoping that 70% would be enough. That was the early thoughts, but it looks like it's going to have to be closer to the 80-90%, and realize that even with certain groups, and over 65 has been very good, and we have 80-90% range in that cohort of people in our country. Still, even though that group, because there are younger people and a lot more younger people, as we go down in age and as the number of those people do not get vaccinated, really at our present vaccination rate, we're really closer to 60% in our country overall. When you include all people, because you have to include all, you have to include babies. And we'll never get to the very youngest at this point in the foreseeable future, although we're trying to push it down to even the 5-year-olds with the next round of science sort of reviewing the literature. But until they are, there's always going to be some people who don't get vaccinated. Everyone who can get vaccinated, we have to be as close to 100% to get the overall to this 80-90%. That's why we still need to do this. Okay, so again, I'm reemphasizing, this is the point when you talk to people around you. It's not about whether you spin just the vaccine wheel or say, I don't want to spin any wheel. You're always going to spin the vaccine wheel, which is to the right, or you're going to spin that other wheel to the left, which was that disease. If you get the disease, this is what could happen to you. And the question is, which one do you want to which one does it make sense that you have to spin one? You can't just walk away and not spin either. You have to spin one of these two wheels. Which one do you want to spin? Okay. So I want to reemphasize this because things change. Obviously, when information has changed, it's caused a lot of distress among some people. But as information grows about this disease, and this is only a year, it's 18 months of disease, as the virus itself changes, we will adapt and we will meet the challenges together. This is an absolute that I believe in, okay? But it means that we have to be willing to adapt and meet the challenges and realize that things will change as time goes on. The first thing that changes is this idea of, with this last variant, this last increase in cases that happened since July, we've decided, okay, let's look at the option of having a third booster. Now, it's interesting because already as far back as May, we already, all the research actually already realized that for severely immunosuppressed people, people who were getting chemotherapy for cancer, transplant patients who are getting immunosuppressed medications for their transplant, that these patients needed 3 shots of either the COVID or the Moderna in order to fulfill get to the goal of your primary series. So that you could have enough antibodies to say that you're protected like other people who get 2 shots at the time. More recently, we've started looking at the data on what happens to those who are over 65. And we were realizing that getting a booster shot, that I'll show you the data in a second, but in the end, that there are people who are more at risk, and there's a safety with getting a third shot, that the side effects that one gets from the third shot are actually less than when you get your first or your second. And because of that, and the fact that it does boost your immune response, when they measure antibodies in your body, in those patients that they say, oh, you've gotten your vaccine, let's measure how many antibodies, quantify how many antibodies you have in your blood month after month after month after getting the vaccine, the first, the second. And they were able to show that even with this third shot, it goes up again. So your antibodies go up after this third booster shot. And why did we even think about these are, and we've really expanded the categories that could qualify for the booster. So if you're looking to get it, you probably will fall into one of these categories and be able to get it, okay? If you're anyone over 65 or older, you qualify. Anyone who's 18 to 65 can qualify if they have any of these, not just their underlying medical conditions, but if they live in a long-term care facility or if they work in a high-risk setting. All of these things qualify you to get the third shot. So if you're looking for it, or if someone's looking for a reason, it's pretty low threshold to get the third booster if you want it. But why would you want to get it? Well, as I mentioned before, there are waning antibodies, titers to the antibodies to the COVID-19, which is measured in blood over time. And they've noticed that when they do this, and in vaccinated population, when they look at the over 65-year and older patients who have been, when they look at their hospitalization rate, at 200 days, it does seem to go up a little bit by 200 days. And so since the second vaccine was given. And so when they saw that little early bump, it's not enough to cause increased deaths, but it's enough to say, let's make sure that this is not an early sign of something that could get a lot worse down the road. And so with the safety of the third shot being considered, and the fact that they wanted to prevent any chance of this becoming worse, they have approved the third shot and recommended it for groups that's 65 or older. Now let's talk a little bit about influenza, then we'll have plenty of time for questions, only 5 more minutes, and then we can have plenty of time for questions.
Can I just interrupt you for 1 second?
Sure.
Because there's a question in the chat that I think has to do with the boosters, and it's this like mix and match concept. So I had 2 Moderna shots 8 months ago. Should I get a Pfizer booster? Do I wait for the Moderna booster? Does it matter that the Moderna booster is at half capacity? So I think people would like any judgment you can give on that.
And as I said, I mean, I will go back to this slide right here. As information grows about the disease and as the virus itself changes, we will adapt and meet the challenges together. So right now, where we're at is that it's very likely that Moderna will be approved very quickly. So there won't be much of a delay in being able to get a third booster for Moderna. The committee that sort of unanimously, that's under the FDA's sort of cycle for approval, that's just before the final FDA approval, said, yes, you should definitely approve it. So it shouldn't be much longer now. I'm hoping it'll be this month. And if it is, then it'll be an easy decision to say then to do it. Because right now we're not yet at the stage where we're saying you can get another vaccine after you've got an initial series from one company to go to the other. But there is early data that it will likely be an option in the future, but we're not yet there to be certain. And that it may be that getting another vaccine may be more helpful, but we don't know. We're looking at those options. Is it more helpful? Is it less helpful? And it's evolving the data on that. But right now, the best data is whatever you got as a vaccine, because we have more patients who are getting the third in studies that have gotten the third similar vaccine to the other 2 that you got, because we have so many more patients in that group to study, to make sure it's safe, to make sure that the reaction is what we expect it to be, that because of that data, we're more certain that that is a safe recommendation to give. And that's where we're at right now. It's the safest recommendation to continue with what you've got. And there are certain early signs that other options will be available in the future, but I think the key here is to take advantage of what is available now. So you'll be able to take the Moderna, I think, in the coming weeks is what it looks like. Any other questions?
Well,
All right, so influenza. Any other questions about that?
Now, there was one very specific question having to do with the question about the Pfizer vaccine. If we have time, we'll do that. If not, I'll send it to you as a question
Okay,
separately.
yeah, we'll have time. I'm almost 5 more minutes from the last slide, and then we have plenty
Okay.
of time for questions.
Yeah.
So influenza, remember, this is the previous title holder for the most deadly pandemic. And in our country in particular, this is the cyclical nature of the influenza virus. We see how it kind of goes from less to more, then less to more, then less to more, except for the fact that in 2020, if you look at the very end here, we actually had almost no influenza in our country at the end of 2020, beginning of 2021. And we'll talk a little bit about why it was so low during that time. But there is a fear that because it's so low, it could bounce back. It could be a rebound, just like there's a rebound in these other kind of pairings here, or low to high, like in 2013 to 2014 or 2017 to 2018. And it's a combination of a lot of factors, but it was one of the things that we're afraid could happen. And it was low because in 2020 we were doing everything to prevent COVID, right? We were social distancing, hand washing, mask wearing. We closed businesses and schools. We stayed, we're staying home. We closed public gatherings. All these things that allow influenza, in addition to COVID, to spread were all, and influenza is not as contagious as COVID, and so it was even more of an impact on influenza that year. But the schools closing are now reopening. Yeah, and kids can get influenza, and when they get influenza, they spread it in schools and then give it to their parents. That's the concern about influenza. And then of course, we had our sports. We went from 2020 to what sports is now we're seeing on TV. It's just as packed as it ever was. This is what's going to bring influenza back to pre-COVID numbers at the very least. The question is it going to be higher or average is the real question. What we can do to control it, we can wear our masks, especially when you're in crowded areas such as mass transit. Even if COVID were to be the levels they are now, which are getting better, appreciate that when you ride the subway, ride a bus, the idea that mask wearing in those is really your highest risk settings, even if you were to take it off when you're kind of more isolated in a park or something. But in crowded areas, it's face mask wearing will help for influenza, just as it helped for COVID. Hand washing, continue to carry around your alcohol-based products as you touch surfaces and wash them. It adds a little bit extra protection. The same thing we always recommend, it's self-isolation when you have viral symptoms. It's something that people, when they get a runny nose, sore throat, they feel well enough to go to work. But when you go to work with those symptoms, you're much more at risk for spreading it to other people. So being still very conscious of, do I have a viral illness, and not putting myself in a position to infect others. And then lastly, and most importantly, flu vaccine. The flu vaccine reduces the chance, just like with COVID, not only of you getting the flu, but of reducing the spread to other people. This is so important from the flu vaccine. There's good data for years and years. We've had data that have described nursing homes where staffs had high vaccination rates versus nursing homes where the staff had lower vaccination rates. Deaths among the residents of those nursing homes were significantly lower. Okay, it protects other people in addition to protecting you, and that's why we recommend the flu vaccine for everyone. And the flu is not nothing. I mean, we can have, in bad flu seasons, we've had over 1,000 deaths a week for periods of time as the flu season rages. I mean, 30,000 is a common number. We've had as high as some of those peaks were 60,000 people dying in our country from flu. And while it's a 10th of COVID, that's still 60,000 people who died that we didn't see in 2020. So can I get the flu shot and the COVID-19 at the same time? And the short answer is yes, you can get them if you're inclined. Because you have to weigh the risks and the benefits, and just thinking about and just as anyone, what are the risks and what are the benefits? Well, there are, early on, there was some theoretical concern that if you were to get 2 vaccines at the same time, that it could reduce, as your body was mounting an immune response to one, it would somehow lessen its ability to produce an immune response to the other. And we just didn't know when vaccine first came out. It was, everyone was sort of made sure that everything was optimized. there were initial some recommendations along those lines to not get other vaccines when you got the COVID. But again, we've had hundreds of millions of people get it. And in that period of time, we have recognized that people have gotten other vaccines and still gotten the COVID vaccine, and there's been no documented decrease in the immune response. So there's no data to say that getting them both at the same time will reduce the efficacy or the effectiveness of the COVID or the influenza vaccine. The only other advantage to doing them, so there's no real disadvantage in that respect. You do the only other advantage side is the idea that there's a convenience advantage. If you can schedule in the next few days to get both, you've gotten both as soon as possible. And the sooner you get the vaccine, the sooner you'll have the benefits of each vaccine. So there's that advantage. So it's a convenience. The only downside really would be the fact that you are increasing the chances of the side effects, which are side effects that people get when they get the flu vaccine year after year. They get arm ache, they get soreness, they may even get a little bit of fever. That same thing can happen with the COVID. So do you increase the chance of feeling side effects? Probably. And so I think it's completely reasonable if you're concerned about the side effects to say, I'd prefer to spread them out and get maybe less side effects each time than to get maybe a greater chance of getting side effects one time. But so far, that really does seem to be the biggest negative for getting them at the same time. Otherwise, there's no data to say that it's going to increase serious complications at all, nor that it would decrease its effectiveness. But there are doctors out there that, talk to everyone. It's your choice as a person what the risks and benefits are on that spectrum, though. And that really seems to be the extent of it at this point. And that's me getting my vaccine all the way back in December, I think it was, of last year. So that's it. So questions. I'm open to questions. If anyone has any questions, please.
Yeah, there are some questions that were in the chat, and then anyone can just open up their mic and ask a question. One question on the flu vaccine, because that's what you were just talking about, was, do you recommend the extra strength flu vaccine for those over 65? And are the extra strength flu shots readily available?
So it is harder sometimes to get the extra strength flu vaccine. I think that that has to be something you talk with your particular doctor about. I actually don't have the data on how much more effective compared with the side effects, how much increased chance of side effects you'll have. So I think that is something that's evolving. This is one of the first years where this extra strength one is going to be widely available. But right now, I do think it is a little bit harder to get. It's better probably to get, if there's any delay, if you try to find someone who can give you the extra strength, and you're finding that it's a delay, it probably is better for you just to get the regular vaccine while waiting, instead of waiting at this point.
And then a couple of COVID questions that were in the chat. One is, why is obesity a factor with COVID?
So the reason, what we saw early on with the virus in terms of deaths, it has to do with when COVID affects your respiratory status, when it starts to affect your lungs. The extra weight associated with patients who have that body mass index actually makes it even harder for them to fight through those respiratory problems. And so their breathing is much more labored, needs much more support for a given amount of infection. And so that's been the problem. It's been the effect of that extra body mass index on their breathing that makes the breathing complications that much worse. So because they died at a higher rate early on in this infection, we were particularly trying to make sure that they did not get the disease. Again, our goal is for people who are at risk for dying, if you're at any increased risk for dying, to do everything we can to help to prevent you from getting the disease.
And then there was a specific question about the Pfizer vaccine that you may or may not be able to answer. It's about the blood clotting issue, microbleeds, and PETECHIAE. I don't know what that is. Connected with Pfizer. Yeah.
So petechiae is just a symptom of a problem with clotting. It's one of the things that you can see with clotting. So the real problem is the clotting. The petechiae are just a way you can see it in some of the people with clotting problems. The real issue is there going to be a clotting problem? My understanding is that the one that had the least type of clotting problems was the Pfizer, but that others, especially the other AstraZeneca, were more associated with this. So, but any of them potentially could, because remember, the virus is designed that the way it's designed is designed in a way that makes your immune reaction cause some damage as well. And in case of the disease, if the virus is able to replicate in your body out of control while you're building up your immune system to it to try to control the amount of virus in your body, the immune response that's bad for your body gets out of control during that time. And one of the things that that does is affect your clotting factors and causes you to have these clots. And patients who had COVID disease, so many of them had clots in their legs and clots in their lungs that had to be treated separate from the actual viral disease itself. The vaccine, because it's using the framework of the virus, probably in 1 in a million gives a little bit of this of the reaction, but it's a small fraction compared to what happens again with the disease. And because of that, we've seen, again, it's 1 in a million that you get these clotting problems from the vaccine. And actually in younger patients, younger women, we saw with some of the vaccines where the rates actually measurable even in the number of people that we'd given it to. And so that group of very young people, remember, was one of the things that held up the Johnson & Johnson rollout for a period of time as we sort of wanted to educate people about the risks and benefits. But again, it was, a handful of cases, less than a dozen with, tens of thousands of the vaccines being given. So it was exceedingly rare, but some of the vaccines had that reaction. I don't remember Pfizer being one that had a particularly high rate for that. I'm sure there's a few cases, but it's not anything that's a specific concern for Pfizer.
Okay. Are there any other questions from people? You can unmute yourself if you have a question.
Yes, I have a question.
Mhm.
My name is Maria. I was wondering, there is a policy right now that allows unvaccinated people to come into the senior centers and mingle with the vaccinated. I was kind of wondering to get a doctor's perspective on a policy of this type, especially with a senior population.
This is the challenge of being so isolated. I mean, I saw this. It's not. I agree with you that there has to be a concern about anyone who has the increased chance of having the virus being in contact with people who are vulnerable. But I will say this: there's also a downside to keeping families apart, not having families be able to see each other. I saw that firsthand, not being able to visit certain people, some family members and close friends who are in nursing homes, for example, and the isolation that they can have has an impact on their health as well. So there is a balance, but I agree with you. I think that unvaccinated people need to have extra vigilance. They have an extra responsibility if they're not vaccinated, not only in terms of the symptoms, but they can be asymptomatic and still have the virus. So they really should have an obligation to be tested as if they were traveling. They need to be tested within 72 hours of coming in would be a recommendation that a lot of institutions have had, that you have to show that you have had a negative test recently, or that that you're wearing a mask, and that the people that you're visiting wear a mask, and that everybody who you're visiting is aware of that. I guess that would be the other concern. If you're wearing a mask, it is so variable what you could do. Everything from limiting them to at all from coming in to when you do allow them to come in, making sure that they have different protocols in terms of how they interact. Everyone should be wearing a mask. Everyone should be hand washing. Everyone should be social distancing. And if that's the case, then it's hard to imagine what more you could really do. But I do agree with you that knowing someone's vaccine status before they come into a place where people are more vulnerable is a requirement. And then once they have that, they have to make special, are you negative? Are you have symptoms? Kind of.
I'm just going to interrupt this conversation for 1 second.
Can I please finish? Can I please finish? There is no requirement right now for them for an unvaccinated person to report that they are unvaccinated. They don't have to say if they're coming into the senior center. Mm-hmm. It's very disconcerting. I had to stop going because I was because of my circumstances, because of my health circumstances.
Right.
Maria, Maria,
Yes.
I just want to make sure we get to other questions. Also, that issue is one that is really for us right now as a senior center. We're not a nursing home, we're a senior center, is really good, is at the discretion of the Department of Health and the Department for the Aging. So we are waiting for that guidance to come from them. The current guidance we have is the current guidance that we have. So that's kind of where we are at this point. And I know it's frustrating to many people, and I totally understand that, but that's where we are right now. Somebody asked a question. I didn't 100% understand it. It just says J&J, Cora, it's from you. J&J, which booster? So I didn't.
So J&J will probably be approved for a second booster as well, for those who got J&J. But again, that'll probably be one of the first vaccines that get approved to have other vaccines after. But we are still in the early stages of making sure what's the safest of all those options. But I suspect you are the furthest away from, you're more weeks away than the other vaccines in terms of when that second booster will be approved. But I've already heard from Fauci, I've already heard from a few people that they feel that a second J&J will likely be the first thing that will be available. But keep in mind that the key is you do have some protection, that you have now antibodies. The key is that everyone who's gotten any of these vaccines has antibodies. The question is how many antibodies and how high. That's going to be the question, and people are going to be working very quickly to get you the data to say it's safe now to get that next dose so that you can keep your antibodies at a higher level.
Thank you. Linda Richter, you have a question. Can you unmute yourself?
Yes, I received the J&J vaccine by having nurses come to my home because I'm in a wheelchair. Do you know if the booster shots will have that program?
No,
available?
I wish I did. I imagine there'll be some organizations that accept that challenge, but as far as I know, there's no specific plan that I know of. But then again, I'm not at a Department of Health level to tell you that.
Thank you.
And Linda, we'll keep in touch, particularly with Selena, and we can also follow up with questions like that. We have a nurse on staff now at RSS, Petronella Phillips, and so I think she'll help manage that information as well.
Thank you. I think it was you. I received that information from you. That's how I knew how to call the Department of Health. Thank you.
Thank you. Any other questions from people?
I actually have a question. This is Petronella, the nurse from RSS.
Hi.
So I was just wondering, Dr. Foster, is there a known reason why some individuals have no side effects from either doses of the vaccine? Because
No.
I was one of those people, like I had nothing. I didn't have any pain, anything.
Excellent.
So
and most won't, but it's the biggest category is to not have severe reactions, although most will have soreness in the arm, I would say. But after that, it is really your genes, the complexity of what creates the variety of antibodies that you then get promoted when you get exposed to any vaccine or any new bacteria or virus is so unique to you. The good news is the body has evolved in a way that it minimizes the chance that your immune system will cause side effects, but it still happens. But there's nothing you can predict. There's no way you can predict that. You just have to, it's a roulette wheel, but again, the roulette wheel is so much better on the vaccine side than it is on the disease side.
thank you.
Anything else from anyone?
Yes, I have a question. My name is Dolores.
Hi, Dolores.
Hi, I'm asking about the booster shot. It was that 8-month time period from the last COVID shot. Is that still the way it should be? 8 months?
Yeah, I believe so. I think I had it in my slide. Let me just make sure. Yeah, 6 months.
6 months.
6 months? Okay, and also, do we just go in where we got a Pfizer? In my case, I had Pfizer, and I went to a city hospital. Do we just go in, or do we need a prescription? What do we need?
Right now, can I just jump in on that? I think just having talked to my own doctor when I was trying to do this, and my doctor's from Columbia Presbyterian, it was basically the advice was to try and go to the local pharmacy to do it. So going to Rite Aid or CVS or Walgreens, because they seem to have the largest stock right now. We have not gotten any information. I haven't gotten any notice, for instance, from Columbia Presbyterian saying you can come here to get the booster. So I think right now the recommendation is to go to your local pharmacy. That's what I understand, Dr. Foster, if you have something different.
Right, and I think having, and then I don't think, did they require that you have your card even when you went to the pharmacy, or?
They did. They asked for
Yeah.
my card. That was all they asked for. They
That
asked
should
for
be all
nothing
you
else.
need.
though.
If you don't have your card, you probably could still get it if you attest to it, but that's so far that's all that's necessary.
Okay, good. Thank you very much.
And there were a lot of appointments. I didn't have any trouble getting an appointment.
Mhm.
Dr.
And then,
Foster,
can
do
I
you
just
recommend the
do-
shingles? Do you
Huh?
recommend the shingles shot?
I'm sorry?
Do you recommend the shingles shot for seniors?
I recommend all vaccines that are presently out there. I think that it is the safety compared to the disease is always in favor of the vaccine. COVID is just the most extreme example of that, where it is just the most the side effects and death and hospitalizations are just such a real possibility for the disease that the vaccine is just, for me, why I go out and I promote it. But I would, if given the opportunity and I saw a need, I would try to promote pretty much every of the vaccine that's out there, including the shingles vaccine. Yes, I just see what it can cause. The pain that it causes when you do get it can be quite severe.
Thank you. Okay.
Oh, and then Nancy, and we'll send that information on to other people, says that, I don't know what it is, but the NMIC hotline is scheduling booster shots, and there's a number there that she's given. So we'll make sure that gets communicated out further. Any other questions for the doctor? If not, I'm going to, 1, 2, 3, nothing else. I'm going to thank you so much. This has been a really important, very timely conversation that I think we'll probably be having in another 6 months as we, learn more about the progress of COVID and what's happened with the flu this year. But we're just encouraging everyone, get your booster if you can, and definitely get your flu shot. It's really, really important this year to do that. So thank you to Dr. Foster. Thank you to NewYork-Presbyterian, Columbia, the whole, all of the words, but to thank NewYork-Presbyterian for allowing us time with the doctor today. We really appreciate it. Reminder that tomorrow at 6 o'clock at night, we have another lecture with doctors from NewYork-Presbyterian. This one is going to be on osteoporosis. It's a really important one. So if you haven't signed up for it, please go to rssny.org/classes and sign up for it. So we're going to let everybody go now. Thank you, Dr. Foster, so much. Thank you, Maria, for all your help. And we'll see everybody soon. Okay?
Thank you so much, Doctor.
Thank you.
You're welcome.
And
Thank you.
RSS.
Thanks so much. Take care, everybody. I'm going to end it. Okay. Bye-bye.
Bye.
Bye-bye.